This is Dr. Ravi Saini. So today's discussion is about bleeding disorders, or we can call them hemorrhagic disorders. So hemorrhagic disorders are broadly classified into inherited and acquired defects. The inherited and the acquired defects. Inherited disorders are passed down through the genetics. In case of acquired disorders, they are developed later in life. Now come to the acquired disorders. In case of acquired disorders, we are having some important disorders like uh, disseminated intravascular coagulation (DIC), the various liver disease-associated bleeding disorders, and vitamin K deficiency bleeding disorders. The second category is the inherited bleeding disorders, in which we have some common examples like the hemophilia A, hemophilia B, von Willebrand disease, and some other uh, inherited bleeding disorders which occurs due to the various factors, and these deficiencies are named after the clotting factors. Now come to the classical hemophilia or hemophilia A. It is also known as classical hemophilia. Classic hemophilia. It is a bleeding disorder that occurs due to the deficiency of factor 8. It is an X-linked recessive hereditary disease. Women are carriers and generally do not suffer from disease as they have second X chromosome, which is usually normal. So basically, mainly males are affected because they have only one X chromosome. Now come to the clinical features. In mild to moderate cases, it could occur due to as a secondary to trauma or surgery. The bleeding usually persists from days to weeks in spite of formation of clots. Bleeding may also occur spontaneously in tissues and cavities of the body. So these are some clinical features. Now come to the treatment portion. Uh, that could be transfusion of fresh blood, as in case of stored blood, the factor 8 rapidly lost. So fresh blood transfusion is important. Transfusion of factor 8 concentrate. Some other plasma products are also available which raises factor 8 concentration. Fresh frozen plasma and cryoprecipitate both contain factor 8, which could be also used for treatment of hemophilia A. Now come the second, hemophilia B, also known as Christmas disease. Hemophilia B. It occurs due to deficiency of factor 9, which is also known as anti-hemophilic factor or the Christmas factor. Etiology, same as it is sex-linked recessive hemorrhagic disease. Clinical features are similar to hemophilia A. The treatment. Now come to the von Willebrand disease. Etiology, it is the most common inherited disease bleeding disorder in humans that occurs due to deficiency of von Willebrand factor. It plays a central role in hemostasis as it serves as a carrier for factor 8 at, and it is essential for adhesion of platelets to the injured vessel wall. So this factor VWF von Willebrand factor helps in carrier for factor 8 and also helps in adhesion of platelets. Deficiency of VWF leads to defect in the formation of both temporary and definitely hemostatic plaque. Because due to deficiency of these factors, VWF and the factor 8, which results in less adhesion of platelets and less formation of hemostatic plaque, which will lead to the von Willebrand disease. The clinical features are also similar to the hemophilia A. There are some various types of VWD. Mainly are the type 1, type 2. In case of type 2, we have type 2A and B, and type 2M and type 2N and type 3. These are some various types of von Willebrand disease. Type 1 is the most common and it is characterized with a mild to moderate decrease in plasma VWF factor. Type 2, it is characterized by the normal levels of von Willebrand factor, but it is functionally defective. So concentration is normal, but they are not able to, or they are not physiologically active or functionally active. Type 3 disease, it is extremely rare and is the most severe form of the disease. These patients have no Willebrand factor activity and have sufficiently low factor 8 levels. Treatment could be the desmopressin, which act as an analog of ADH and increases the factor 8 activity. Now come to the DIC, which is called disseminated intravascular coagulation. It is a syndrome in which there is a widespread intravascular coagulation occurs due to procoagulants. So what are the procoagulants? They are produced due to presence of large amount of traumatized or dying tissue in the body and releases great quantities of tissue factors into the blood, especially in case of septicemia, in which bacterial toxins, mainly endotoxins, activate the clotting mechanism. So due to septicemia, the bacterial toxins are increasing, mainly endotoxins, which results into the activation of clotting mechanisms, which is responsible for the overactivity of these procoagulants or coagulants, and finally by the and finally these platelet plugs, they'll plug small peripheral vessels greatly and decreases delivery of the oxygen and other nutrients to the tissues, which finally lead to the circulatory shock. Etiology: in this condition, coagulation factors and platelets are overutilized. This results in bleeding. The most common procoagulant is the tissue factor 3 or the tissue thromboplastin. These procoagulants are very much important in case of DIC that activates extrinsic pathway of coagulation. That factor 3 and tissue thromboplastin activates extrinsic pathway of the coagulation, and due to these procoagulants, there is an overactivity of uh, coagulation, which results in the overutilization of these factors. So when any trauma, when in any other condition of trauma, there will be no remaining factors available for clotting. So there will be that will result into bleeding. In case of clinical features, multi-organ dysfunction, which could be resultant due to widespread embolism, bleeding by the overconsumption of platelets, fibrinogen factor, and factor 8. In case of treatment portion, the first thing in which we should concentrate about the elimination of these precipitating factors, means those factors which are aggravating the condition of this disease are called precipitating factors. So first we should remove these precipitating factors. After that, replaced the deficient coagulation factors and platelets. Finally, blood component therapy. is needed for those who bleed excessively. These could be the treatment modalities in case of TIC. Now come to the second section, the liver disease associated bleeding disorders and the vitamin K deficiency bleeding disorder. Disease of the liver such as hepatitis, cirrhosis, or vitamin K deficiency can sometimes depress the clotting system, which finally results into tendency of bleeding in patients. Vitamin K is necessary for the formation of the five important clotting factors, the prothrombin, factor 7, factor 9, factor 10, and protein C. So vitamin K is necessary for the formation of these factors. In the absence of vitamin K, subsequent insufficiency of these coagulation factors finally lead to serious bleeding disorders. So liver is the formation site of these clotting factors, and vitamin K is a main have a main role in formation of these factors. In case of treatment, as there is a deficiency of vitamin K, so naturally vitamin K should be given 4 to 8 hours before the any surgery, because which could lead to the excessive bleeding during surgery. The next disease is thrombocytopenia. It is characterized by the presence of very low number of platelets. The name is thrombocytopenia, means there is a deficiency of platelets. As a result, small hemorrhage occurs throughout all the body tissues. The skin have some many small purplish blotches which are called thrombocytopenic purpura. These hemorrhagic spots under the skin are called purpuric spots because they are purple colored patches. Like appearance, they are having a purple colored patch appearance. That's why this disease is called purpura. Also sometimes collects in large areas beneath the skin which are called ecchymosis. The next disorder is the thrombosis. It is an intravascular clot which obstructs normal blood. It is an intravascular clot which obstructs the normal blood flow. Uh, Normally, there is a balance between coagulation and anticoagulation. So, thrombus generally it is not formed. But in case of pathological situations, intravascular coagulation could occur. This condition can result in blockage of these arteries and veins, which could lead to serious complications such as heart attack or stroke. And this clot could travel to some other important vital organs as well. Now come to thrombi. It is an abnormal clot that develops in a blood vessel. Is called thrombus. In case of emboli, once a clot has been developed and it breaks away from its attachment and flow with the blood and leads to the blockage of some other site, is called emboli. These are some clotting factors. Fibrinogen, prothrombin, tissue factor, calcium factor, that is factor 7, 8, 9, 10, 11, 12, 13.